Hey GI health advocates! Have you ever cared for a patient with chronic bloating, unexplained fatigue, or nutritional deficiencies, and their symptoms just didn't add up? You could be looking at celiac disease, an autoimmune condition triggered by gluten that damages the small intestine and disrupts nutrient absorption. Today, we're unpacking the pathophysiology, how to recognize celiac, and how nurses play a vital role in education, lifestyle support, and monitoring long-term health. Celiac disease is a chronic autoimmune disorder in which ingestion of gluten, a protein found in wheat, barley, and rye, triggers an immune response that damages the small intestine lining, specifically the villi. This damage impairs nutrient absorption and leads to malnutrition, even in patients eating well. It affects about 1 in 100 people, but many go undiagnosed due to non-GI symptoms or mild presentations. Gastrointestinal symptoms include chronic diarrhea or constipation, bloating and gas, abdominal pain, nausea, and vomiting. Non-GI symptoms include fatigue, iron deficiency, anemia, weight loss or failure to thrive in kids, dermatitis herpetiformis or an itchy skin rash, headaches, joint pain, infertility, and neurological symptoms like peripheral neuropathy. Serologic tests include tTG-IgA or tissue transglutaminase. Antibodies is first line. Total serum IgA to rule out false negatives. Endoscopy with biopsy confirms villus atrophy in the small intestine. Important: testing must be done while the patient is still eating gluten, not after going gluten-free. There is no cure. Management relies on a strict, lifelong gluten-free diet. Even tiny amounts can trigger inflammation. Patients must avoid wheat, barley, rye, spelt, malt, brewer's yeast. Cross-contamination is a major concern, especially in shared kitchens, restaurants, and food prep environments. Educate on gluten-free living. Teach label reading, hidden gluten sources, and cross-contamination risks. Refer to a dietitian with celiac expertise. Guide families through school, travel, and dining challenges. Monitor nutritional deficiencies. Watch iron, folate, calcium, vitamin D, and B12 levels. Encourage bone density screening for osteopenia or osteoporosis risk. Recommend gluten-free multivitamin supplementation. Support symptom tracking. Document and address lingering symptoms. Evaluate for non-responsive celiac disease or coexisting conditions like IBS or lactose intolerance. Screen and educate family members. First-degree relatives should be screened even if asymptomatic. Celiac is genetic and autoimmune, not just a food intolerance. Celiac disease doesn't end at the gut, it affects the whole person. Nurses are key in providing clear education, emotional support, and tools for everyday living. What's your top tip for teaching gluten-free living? Drop it in the comments. Like, subscribe, and follow for more GI-focused nursing content, because knowledge is the best nutrition. And remember, identify, educate, empower wellness.